Good morning, everybody. Good afternoon. My name is Miguel Vasquez. I am a founding member of PHEAL, which is the Planning for Health Equity, Advocacy, and Leadership. We've been in operation since 2020, and since then, we've been able to organize different opportunities for our members and audience to get involved in the space of health equity. Today, we have a very special program. We are partnering with a healthy blueprint, and we're going to be exploring achieving equitable access to green spaces and environmental benefits. We were able to secure three amazing speakers, and you will be amazed about the content that will be shared today. And to get us throughout the program today, it is my pleasure to introduce you to Belinda Choi. Belinda is our current project manager, but Belinda is the founder of A Healthy Blueprint. She has a decade of experience creating community-led solutions for environmental justice, climate adaptation, in health equity in the US and internationally. She has spent most of her career in the nonprofit and advocacy space while also consulting across sectors. She currently, as I mentioned, serves as the project manager for PHEAL, where she leads community engagement and education activities. And with that, please help me welcome Belinda with a round of a virtual applause. Belinda, you're on.
Thank you so much, Miguel. Welcome, everyone, and thank you again for joining us. I am so excited to be welcoming all of you today. It seems like we have really great attendance. We have 36 and counting people who are joining us today. I'd like to take a moment and acknowledge the lands from which we will all be presenting from and invite you to consider donating to the Indian Land Tenure Foundation or some of the organizations that are listed on NASIG. So before we begin, let's go over some housekeeping items for today. If you'd like to turn on captions for this webinar, you can enable closed captions at the bottom of your screen in the menu bar. If you have questions that you'd like to ask panelists during Q&A, you can change the chat box setting to host and co-host so we can keep track of your questions. As a reminder, this webinar is being recorded and will be shared following the presentation. Our recording will be shared on the PHEAL website, and our slide deck will be shared in an email following this presentation. So I'm very excited to be introducing our panelists for today. First up, we have Rachel Bennett. Rachel is the Director of Health Equity at MIG with over 15 years of experience in health equity and the built environment. She currently manages the Los Angeles County-wide Parks Needs Assessment Plus implementation, turning an equity assessment into strategies for park development and funding in high-need areas. Previously, she directed the Robert Wood Johnson Foundation's People, Parks, and Power initiative, supporting community-led advocacy for park equity in Black, Latino, and Indigenous communities. Next up, we have Tiffany Eng. Tiffany is a community organizer, planner, and an avid hiker and camper with over 20 years of experience working on coalition-led campaigns for racial justice and healthy cities. Before joining on as senior associate at Ramey & Associates, Tiffany co-led the Green Zones initiative with the California Environmental Justice Alliance that advances community-led solutions for environmental and climate justice at the neighborhood level. Last, but certainly not least, we have Emily Gavino. Emily is a senior associate at Clarion Associates, a national land use planning and zoning consulting firm with offices in Chapel Hill, North Carolina, and Denver, Colorado. Emily's work focuses on comprehensive and land use plans for local governments, primarily in the Southeast US. She brings an interdisciplinary approach to her work, and she's passionate about helping communities plan for a resilient and sustainable future and engaging the community in thoughtful and equitable ways. Please join me in welcoming them all today. So as a reminder for all the participants who are tuning in, we are going to start off with brief presentations from each of our speakers, followed by a moderated discussion, and then we'll have time towards the end for a brief Q&A. So I will be happy to turn it over to Rachel to begin her presentation.
Thank you so much, Belinda. Thank you, Miguel. Just quick sound check. Is my sound okay? Can folks hear me? Great. Okay. It's an honor to be here with you all. I have been a participant at many PHEAL events and APA events over the last 15 years and really came up in this profession under the wings of people like Miguel and several of you on the call. So I'm glad to be here kind of in thought partnership with you all today. As Belinda said, my background is in both public health and city planning. And I started out as a generalist. I sort of started out from the perspective that all kinds of planning decisions impact people's health. And so if we can center health, and particularly health equity in planning decisions, that will drive better outcomes, more participatory processes, and we'll see the difference in not only community cohesion and sort of power balances, but also in people's health outcomes. I didn't necessarily expect to specialize in any of the social determinants of health because I really do feel like there's value in seeing the interconnections among issues. But fate would have it another way. And I have spent much of the last 10 years doing more of a deep dive on how access to nature in cities in particular is really a critical determinant of health. So for some folks, this will be sort of newer information. For other folks, you're very familiar, but I just want to set the context a little bit and tell you about why I find this to be such an exciting and important issue, an intersection of issues to work on. So all of us who have a health background know that, parks and green spaces, trees, trails, things like that are really critical for health. They promote physical activity. They promote places to gather. They promote mental health and well-being by reducing stress, by speeding healing from illnesses or injuries. They combat loneliness and social isolation, definitely something that a lot of us saw and felt during the pandemic. But also these green spaces in cities, they cool temperatures, they clean stormwater runoff and help prevent flooding. They promote climate resilience in a whole bunch of ways. And then also when emergencies strike, whether that's climate disasters or any number of other community crises, parks in particular are sort of a first response center, providing emergency shelter or food or all these things. So parks are sort of a superpower when it comes to health. Now, with that being said, like so many other issues, parks are not distributed equally or equitably in many of our communities. This is a map from Los Angeles County. It's the largest county in the country. I see several partners here on the line today who I know from my work in LA. What you're seeing here is a map from a 2016 needs assessment that looked at who has park access in LA County and who doesn't. And, it's no surprise here that the neighborhoods where there is less park access, so the red and the green, that's correlated with a higher proportion of residents who are people of color, who have lower incomes, who are immigrant or refugee populations. So again, back to the social determinants of health, this reflects spatially as well. One of my mentors, Dick Jackson, has often said that the built environment is social policy in concrete. I would add not only concrete, also in greenery here, but I think our park inequities really reflect some of our social values in a way that puts unfairness really front and center. And so many people are working to change that. I'm not going to talk too much about the causes of why, although there's certainly a lot that we could say about that. But, as public health people, what we do is we start by asking, what are the root causes of this? It's not just about symptoms, it's about the real causes. And a lot of the causes of park inequities and the health inequities that stem from them are these big policy decisions. Some of them have been made by planners. Some of them have been made, by broader government agencies. Some of them are more just sort of social forces. But all of these things have sort of worked together, kind of like gears in a machine to produce park inequities that we see today. And it's complicated. This is a lot of decades of policy work to undo and to right. But one of the things that I come back to a lot in my work, if you all don't know, the University of Richmond in Virginia has this project called Mapping Inequality, where they compiled the Homeowners Loan Corporation maps, the redlining maps from the 1930s. I know we talk a lot about redlining as being a root cause, and that's because it was such a kind of a schism in so many ways for how our cities were going to look and feel. This map, I mean, this is a compilation of over 130 city maps from across the country. And you see, like, this was happening everywhere, not quite 100 years ago. And we're still feeling the impacts of this. And we know that these policy decisions still impact people's health and access to opportunities today. So I think it's really important for all of us to be rooted in kind of the context of how we got here, but then not to stay stuck. I think public health people, we have a tendency to really ask about the problem, and it's harder to get to the solutions, in part because we don't have control over all of them. I want to mention a quick issue that's going to come up in our conversations today. I'm sure it's coming up in the work that you all are doing, which is as we invest deeply in parks, as we right some of these wrongs, as we bring communities into decision-making power and create greener, healthier, more resilient communities, we cannot cause gentrification and displacement, because then we will be perpetuating the harms that we have worked hard to disrupt. So how we do that is a much thornier question. It's something we'll get into, but I'll pass it to Tiffany in just a sec, but I'll just say, this is an issue area that is so intersectional. You might think of parks and you might think of like a soccer league or a playground or a walking trail or something. If you care about climate, you should care about park equity. If you care about EJ, you should care about park equity. If you care about economic development, workforce development, affordable housing, any of these issues, you should care about park equity. And there's lots of great work being done in communities across the country that you can be part of, or you can start your own thing because the issues are out there. So I'm going to pass it to Tiffany now. She's going to do a deeper dive on the environmental justice implications of access to parks and green space and share some work she's done in communities that are working on this.
Thanks so much, Rachel. Yeah, hi everyone. My name is Tiffany Ng. I use she and they pronouns, and I'm currently a senior associate at Raymond Associates. But before my time with RNA, I was also a part of the California Environmental Justice Alliance, which is a statewide community-led coalition that fights for environmental and climate justice policy changes. So I want to talk about park equity within this framework of EJ and climate justice, lifting up the work of both the SEHA Alliance and some of the work of RNA. So when it comes to EJ, there's a lot of technical ways of talking about EJ, but a lot of groups like to talk about it as the basic right of people to live, work, go to school, play and pray in a healthy and clean environment. This concept of EJ and the EJ movement is very based in both the civil rights movement as well as the broader environmental movement, and focuses on various forms of justice. We talk about how EJ is both about distributive justice, which is about making sure that people have an opportunity to participate in the process where decisions get created. And also, sorry, got that switched. Distributive justice, which is about making sure that people have equitable access to benefits in their communities, especially those who have been denied access to benefits in the past. And also procedural justice, which is about how decisions are made and making sure people are included in decision making. So when it comes to state laws that work on parks equity through this EJ or climate justice lens, there's a number that people can actually tap into to improve equitable access to parks and make sure that people can also access open space, especially for environmental justice or underserved communities that may lack access to those kinds of investments. So I want to highlight a couple, but really SB 1000, which I've worked on more in the past, but SB 859, which was passed in 2016, created the state's first urban greening program, which, in addition to reducing greenhouse gas emissions, must create, enhance, or expand community parks and green spaces. And a lot of the work does have to go to either be located in or serving a disadvantaged community, also known as environmental justice community. SB 1000 by Senator Levin 2016 requires cities and counties to provide an environmental justice element in their general plans. As you know, general plans are like blueprints for a city to kind of develop over time. And so it's really making sure that this lens of EJ is embedded in all the work throughout those chapters or elements of a general plan. The governor's 30 by 30 initiative, which passed in 2020, is basically an initiative for land conservation to make sure that we can conserve local lands and coastal waters through collaborative actions together with partners to make sure that we restore and conserve biodiversity, expand access to nature, and mitigate and build resilience to climate change. I'm not going to go through all the other ones, but if you want to have more information about them, AB 30 is the Equitable Outdoor Access Act. AB 1757 is about developing targets for nature-based solutions. And another law, which is very connected to SB 1000, is SB 1425, which requires general plans to be, requires cities and counties to update their general plan open space elements by 2026 to include access to open space for all residents and promote climate resilience and other benefits, including rewilding opportunities. So with this in mind, I want to talk a little bit more about SB 1000 and some of the opportunities that you can tap into through this law, which again, this law, which actually was rooted in work led by EJ groups on the ground, both the Center for Community Action and Environmental Justice based in Harupa Valley and the Environmental Health Coalition based in National City. Both of those two organizations work with local cities to create the two first EJ elements, or health and EJ elements, in the state of California that inspired the creation of SB 1000 that we have today. So two parts of the law that you can really pay attention to is like, the law talks about reducing pollution exposure, improving air quality, promoting public facilities like libraries, parks, recreation centers, promoting food access, ensuring safe and sanitary homes, providing opportunities for physical activity, and making sure that the community has opportunities for civic engagement and public decision-making, such as government decisions. So if you think about the ways in which you can tap into this law, like every city and county has to do a general plan update over time. It's really important that communities are included in this process to update that plan, because they can give feedback to things like what kinds of infrastructure can be community serving for low-income communities of color that experience high pollution burdens. Are there areas of your neighborhood that actually lack access to like healthy open space or green space, or other kinds of facilities where people can gather and have like active activities? Are there ways to enhance roads and trails and provide connections between the place where people need to go and their homes? Physical activity is another way in which you can really think about enhancing and promoting equitable park space. So when I think you've seen parks where there's lots of ways in which you can have jungle gyms, you can have like even like exercise equipment for adults and youth. You can create trails. And so these are one way, through this law to like access and promote equitable park creation. In terms of lessons learned, I think it's always good to talk about like, laws are great in theory, but how do you like make them real in practice? We've learned over time through work through the CEJA Alliance and also work by many researchers like Dr. Mendez and Dr. Zuniga, that it's important to partner with communities from the very beginning of the planning process, from beginning through implementation. It's always important to go where people are at and not expect people to come to you, especially when you're trying to, address issues of like procedural justice and environmental justice. And make sure you partner with community engagement experts, so resident leaders, CBOs, and others who know the neighborhoods on the ground and can give you valuable expertise and insight to making those neighborhoods even more vibrant. If you want more information about ways in which, this law, SB 1000, could be better implemented, I wanted to lift up again Dr. Mendez and Dr. Zuniga's work. They have lots of recommendations from like a procedural perspective and also a policy perspective on how to make it so that when we are planning for environmental justice, we can actually create those and implement those solutions in reality. But a lot of times implementation does depend on leadership and the commitment of city council and boards of supervisors to make sure that, we can make those plans into reality. But in a more fun way, I also want to lift up the work of local groups that are doing EJ Farms work on the ground, that are really great case studies and showing how you can have community-led solutions for parks that benefit everybody and address equity and climate goals. So if you're familiar with Poder is a group that works in both the Excelsior and Mission districts of San Francisco. They've worked on numerous parks, including Parque Niños Unidos and also Inchan Cajal, which they led with their mine organizing team. But the one I wanted to lift up was actually Poder's Hummingbird Farm, which they created in partnership with local community residents and with a partnership between SF Parks and the California Public Utilities District or Commission, the CPUC. Long story short, they were able to get a stewardship license under the PUC's Community Benefits Program to make sure that the community could find ways to grow their own food, have plants for medicinal purposes, and provide a space for community gatherings. As an EJ org, they recognize that not only is it important to have access to healthy food and community space, but their area of the city is actually a very polluted, historically polluted area because of the way it's zoned in the past. And there's a lot of industry near homes. And so they said, like, how can we transform this area that was largely abandoned and covered in trash into an area that was vibrant and community serving? How can we make sure that people can heal their bodies and heal the land and have access to land in ways that they were denied in the past? And so they worked with Supervisor John Avalos, who was a supervisor of District 11, to make this plan a reality, and were able to get funding from the SFPUC to make the garden happen. So the most amazing part about this project was that they did door knocking, they talked to elders, they worked with students, they actually partnered with both the Chinese Progressive Association to do outreach in Chinese and outreach in Tagalog through the Filipino Cultural Center, to collect about 300 interviews and surveys in the neighborhood to see what did they want from the farm. So today you can see that Hummingbird Farm is a place where students of all ages and people of all ages can go to do ceremony, to actually get internships, to learn how to work the land, to get access to healthy food, and to do celebrations events like Dia de los Muertos, Mother's Day, and other important cultural events. So that's one real great case study I wanted to lift up. Another one, oh, that's also a great picture, a couple of great pictures of Poder's work on Hummingbird Farm. Another case study that I think is really great is by Communities for a Better Environment in both Wilmington and Southeast, Communities for a Better Environment that work in both the Bay Area and in Southeast LA and Wilmington. Their staff partnered with to enrich parks in small cities that really don't have the capacity to do the work themselves. And so under an LA program, they partner with the LA Neighborhood Land Trust to address park issues in both the cities of Maywood and Cudahy, to show that, park equity, parks can be for everybody. So when they actually did the outreach, which they did through working with local street vendors who are on the ground, who have lots of relationships with local residents, they also did outreach with schools and students to make sure that people who are living in those neighborhoods could outreach and build community with those neighborhoods. They learned that the survey showed that people didn't actually want new parks. They wanted to renovate existing parks that had a lot of space and opportunities to build up a community space. And so CBE worked with residents, students, and vendors, and also indigenous partners like the Sacred Places Institute, to design the park and also make sure that the park was community serving. And so they were able to design native gardens. They made sure that there was Tongva art and signage present to make sure that we recognize the original people of the land. They actually also allowed people to design the park and become CBE members in the end. So not only was this an issue where people could just work on a park, but they're able to join CBE as an organization to do greater community organizing for their neighborhoods. And so, for instance, after doing the park work with CBE, a lot of members were able to work with CBE to pass rent control in their neighborhoods, because they know that the issues between parks and housing and food and water and pollution are all connected. So they need to make holistic solutions to help enrich their communities. So the park is going to break ground sometime at the end of this year, and we look forward to seeing how that's going to play out in implementation. I wanted to pass this off to Emily to talk more about the policies around park equity. But before I, pass that on, I wanted to also mention that while we are talking about parks and green space, sometimes green space is kind of a misnomer, because not all spaces are green. For some areas of the state that are more arid and are more desert areas, we have to think about like, what does it look like to have access to parks and open space when the climate is very different? So I wanted to also note that. Thanks.
Thanks so much, Tiffany. I wanted to wrap this up with kind of a bird's eye view as we're thinking about policy, which is the primary focus of my work. I work mostly in comprehensive plans, long-range plans at the local level. And I work primarily in North Carolina, South Carolina, Virginia, the southeastern United States. So coming from a background of both public health and planning, and you all in this webinar are most likely familiar with the social determinants of health, the conditions in which people are born, grow, work, live, and age. So I won't spend too much time going into depth about these, but what I did want to point out is I think sometimes when people talk about the social determinants of health, they miss the second part, that the social determinants of health really influence people's access to power, money, and resources, which really can exacerbate or continue drivers of health inequity. So when we're talking about parks and green space access or inequities in that aspect, all of these are tied together in pretty complicated and intricate ways. And so when we're thinking about how can planning influence the social determinants of health, some things that Tiffany and Rachel have touched on are things like food deserts and food swamps. So food deserts being the lack of access to healthy and culturally appropriate food, or food swamps, which is the oversaturation of unhealthy food and lack of access to what would be healthy and culturally appropriate. We're also thinking about things like lack of transportation options to access healthcare services or facilities, EJ issues and pollution, and people's impact on health behavior, which a lot of times our access to green space, to recreation, and to things like sidewalks can kind of fit into multiple of these categories when we're thinking about health behavior. How are parks connected? How do you access them? And how do you get to them? And different transportation options can all be connected. So when we're thinking about just a couple of those examples that are fully within the planner's wheelhouse of addressing, we're thinking about how does this either continue to worsen health disparities, and how can it increase conditions like heart disease, cancer, stroke, and chronic respiratory diseases, which are the leading causes of death in the United States, in varying degrees of order depending on the year. So I wanted to pull up some resources that when we really zoom out and we're thinking about policy frameworks for health, parks and green space and equity in those areas really fit into these larger conversations we're having both at the national level and at the international level when we're thinking about these different frameworks. So one of them are the Sustainable Development Goals. If you're not familiar with them, they have a really great website that goes into really detailed feedback on each one of these and how they're being measured across the world. But health is really fitting into these, and you can see how both public health practitioners' work and planners' work can fit into these sustainable development goals. There's also some resources from UN Habitat and the World Health Organization that are specifically thinking about health and urban planning. They call it urban and territorial planning when you're thinking about that international perspective. But they have this source book, which a lot of it is thinking about parks and green space equity. And as Tiffany mentioned, green space can really look very different depending on the geographic area where you're coming from. And in the US, we have the CDC Healthy People 2030, which can kind of give you this foundational policy framework for how we're talking about health. And if you're not familiar with it already, many states have their own version of Healthy People 2030. So North Carolina has its own version that they're using that aligns with that national framework, but then has some more specificity to our state as well. So when I'm working with communities, trying to think about how are we looking at health equity, parks and recreation, and green space, we're thinking about how do we have health in all policies. Both Rachel and Tiffany kind of talked about this a little bit as well, that we're looking at how do we systematically consider the health implications of decisions in everything that we do. The second part of seeking synergies is kind of a buzzwordy way to say, how do we find ways to collaborate? How do we look to collaborate across both public sector and private sector and with nonprofits and community organizations, which is how really great projects get accomplished, some of which Tiffany went through. And the last one is talking about how do we really avoid harmful impacts, like Rachel shared the example of how do we avoid green gentrification when we're trying to increase access to parks? How do we avoid harmful impacts? Wanted to share a very quick example of when we're thinking about how does this actually apply in real life and how do we actually start doing this. I work with planners who are doing long-range planning. So they might not have the resources or the staff capacity or the funding to do their own parks and recreation plan or to do a study in their local area. But if they have zoning in North Carolina, they have to have a comprehensive plan or a general plan, as it's called in other states like California. So what I'm trying to encourage with different communities, and I think there's kind of greater awareness and knowledge on planners' part about this, is how do you start getting the information that you need to put this into your policy framework? So my first step is to advise to take a look at the community health assessment for either the county or the municipality, sometimes a regional level, and seeing what are the priorities in that health assessment, and then figuring out how does that align with what the planning department or the public works department or other department, the parks and recreation department, are putting into practice when they're looking at parks and green space and different land use decisions. So the Buncombe County health assessment that we were looking at when we were working on the comprehensive plan just a year or so ago has these two things, which is everyone has access to resources, skills, and supportive environments for resilience and well-being. And this idea that all babies have a healthy start with opportunity to reach their full potential. So as public health people, this included a lot of data about the population within the report, but that part really struck me because this is very related to what planners are doing in their work in comprehensive plans. So this is just one example from the comprehensive plan that Buncombe County adopted in 2023, and it won a North Carolina chapter award. But we had a health and recreation goal. So one goal was specifically about how do you have access to natural resources and recreational lands and parks, and how are you prioritizing access specifically for historically disadvantaged communities to access those resources. And the second part of that was thinking about how do we have equitable access to healthcare services, both geographic proximity wise and transportation and kind of multiple different layers of that support improved health outcomes and support the social determinants of health. There are other ways that this fits. These two fit together, like economic development and resilience and things like that. But I think having these policy priorities set up at the very baseline level in a comprehensive plan can allow planners to have a jumping off point for other projects and things that they want to work on. So I'll end with this. This is a very oversimplified 5 steps for thinking about health and all policies for planners that I've been mulling over and thinking through in this space. But the first one is gathering applicable data. Rachel mentioned that public health practitioners are really good at getting all the information and thinking through all the data and information you need to make decisions about health outcomes. And so planners can really leverage that because someone else in public health has probably already done this research, already created a dashboard, or already pulled this together for their area. And it's for the planners to be able to leverage it. The second one is connecting with the health community. We have conversations at the beginning of every comprehensive plan process, and we try to include the health department or local health organizations in those conversations to figure out what are their priorities and how can there be connections between what these local governments are already doing. And the third is coordinating efforts and sharing impactful examples. This really relates to me thinking about public health departments and organizations are often have grant funding or are going after grant funding that they can use for projects that planners can be leveraging into things that they're already doing. Like if they're doing renovations for a park or maintenance of a park, how do you connect that with things that people are already, the projects they're already trying to get off the ground? The fourth one is updating policy guidance, which I talked a little bit about, making sure that there's flexibility and prioritization in your policies that leave room for talking about health in all of those policies. And the fifth, you could have probably a whole separate webinar about, which would be implementing through regulations. How do you take a look at health in your zoning code, and how do you take a look at health in how you're setting up those parks and recreation spaces so that they're accessible to everyone? Melinda, I'll pass it back to you.
Thank you, Emily, and thank you, Tiffany, and thank you, Rachel, for your great presentations. We are running a little overtime, but I really am looking forward to this conversation. I know that there's a lot of questions that are coming into the chat, so if people have a little time afterward, hopefully our speakers will be able to stay with us till at least 2 o'clock Eastern. Okay, let's just dive in. So as many of you may have known, The Lancet had recently released their 2024 report on health and climate change. And it was found that cities haven't really invested to expand their urban green spaces since 2015. The rate or percentage of the cities with at least moderate exposure to greenness stayed constant at 28%. So one of the key barriers that cities have said that they are that are preventing them from expanding or engaging in climate adaptation work is lack of funding. I'd like to start with Rachel here and ask, how can cities invest in green spaces to improve climate resilience and increase access for vulnerable communities?
It's a great question, and I hope that my answer can touch on a couple of points and questions folks have made in the chat too. Miguel mentioned in the chat that there's a real tension, especially in urbanized areas, but just sort of generally anywhere when there is available land, about how that land should be used, whether it should be a park, whether it should be housing, whether it should be, I mean, we're not even going to get into the whole market rate versus affordable housing thing, but there's so many decision points there. I will say that I think more data is not always the answer here. It's like we know that increasing nature access is good for people, and we know that it's essential for climate resilience. I think at this point, it's more a matter of building the political will, and I would say resourcing the community-based organizations and the advocacy organizations that are going to hold people in decision-making positions accountable for the commitments they're making. So I think it's much more about like the movement building work that Tiffany was getting at. The policies and the plans have to be in place. Absolutely. The stuff Emily is talking about, you gotta have it in the comprehensive plan. You gotta have the interconnections. You gotta have people willing to throw down money. But if there is not the ground game of holding the municipality accountable for those commitments, it's going to keep falling short. And I think it gets really tricky when we pit essential community resources against one another. I really would love, I hope this isn't too naive, but like I would love to see us as a field move through the parks versus housing debate, because it's like, I don't know, why don't we look at all the parking lots, right? Like, why don't we can just get creative. And yes, there are policies in place there, and there would be immense political pushback there, and parking is a whole thing, right? But like, I don't think that we do ourselves a service by getting stuck in parks versus housing. People need parks, people need housing. So let's get creative.
Totally agree with you, Rachel. I wanted to leave the floor open if Emily or Tiffany wanted to share any thoughts.
I just want to say I completely agree with Rachel, and I think the something that we deal with in states like North Carolina, where we don't have a ton of tools that are allowed at the state level, where we can say to a developer, you have to develop this way and provide green space. We can try our best to encourage or to incentivize and kind of combine these things, but we don't have a lot of, we have more carrots than we have sticks, as they say. So trying to think about how are we that creative aspect, I think is really important that Rachel mentioned. And the other aspect that I didn't go into, but I think you can talk a lot about is how are you connecting your policies and the work that departments are already doing? How are you connecting that with the capital investment process? So there are dollars tied to it. How are you really focusing on that plan implementation through capital investment is going to be really key, because that's going to be what the community sees of how they're investing their money and how things are happening in the community, and what they can control if they can't be asking developers to add things like that in new developments.
Yeah, I was going to say something similar to what Emily said, which is that when I talk to Ramey Associates, because they do some parks work, obviously, they talk a lot about how do you stack fees and grants together and kind of do multiple projects at once to like leverage funding. So there could be grants that, for instance, like work on like stormwater runoff, but you can partner that with things like parks and like green space creation to like leverage funding. There's also, I think, something, and I'm not super familiar with this, called the Quimby Ordinance, which I think also affects many states, where you can like work on that to leverage new development to get fees, like development fees and mitigation fees, to help produce things like parks and park benefits. So I guess it's like, how do you look at the funding sources available and the opportunities available to do development and make sure that they can like build on each other, which I think is a great idea, because we're not trying to just build housing in isolation. Sorry, I can't speak English right now. It's about building housing connected to active transportation systems, connected to parks and other, transportation options, so that you have like whole vibrant communities. And so I think that if you can take that approach with the funding mechanisms, that'd be great too.
I think it's really important with policies like Quimby. So essentially that's saying developers either need to build in some green space so that as they're creating new developments, there is, the sort of commensurate green space on site, or they can do a set aside, put money into a pooled fund that the city or county can use to develop green space somewhere else. We have to look with an equity lens on that, because what happens is when development is happening in one area of a city, happens all the time, right? Like a stadium district, or, whatever new speculative thing is happening, that's where all the money is pouring in. There are a lot of urban areas that are built out already, and to Leonor's point, there's a lot of areas where there's contaminated land, and the only land available for new parks is really, expensive to remediate and to make safe and healthy again. So again, I feel like, Tiffany, I'm glad you pointed out that policy. I feel like that's a really good one for us to know about. And I do think there's a need to look at, this is so wonky, but something like the radius of, if a developer is required to build the green space somewhere, maybe it's not just in the neighborhood where that development is happening. Maybe it could go into an equity priority community or something. Again, we know where the problems are. We just have to make sure that at each step of the policy implementation process, we're looking at who benefits, who might bear the burdens, and sort of, to someone's point in the chat, what are the whole community health impacts of this decision?
Mm-hmm. No, that's a really good point, Rachel. And I think just one last thing before we go on to the next question. I think that's why the Poder and CBE cases are so great, is because they use underutilized government land and they use government grants to like identify where are the locations of the city that are under resourced, and like put the parks there with community input. So yeah, I totally agree.
Thank you both for this great back and forth conversation, Emily, as well. Okay, so moving on to this next conversation, which I think is going to be very relevant for everyone right now. I think all of us have experienced extreme weather events in the last year, in the last month. I'm based in New York City, and in my lifetime, I have never experienced wildfires. And in Prospect Park in Brooklyn, we had wildfires along the New York-New Jersey border. Thousands of acres have burned in November alone. I'm sure you all have perspectives to share here, but I'd like to turn it over to Tiffany first. How can we address the challenges of maintaining green spaces in the face of climate impacts?
Yeah, I have a number of thoughts on this. I think one thing that, I talked about in my presentation was this idea of co-governance or co-stewardship. I think that when you're able to have a relationship with local residents on how those parks or green spaces or open spaces can be maintained and developed over time, I think that you have a lot more resource to make sure that not only is it community serving, but that it makes sense with the local climate. So a lot of research goes into like, what are those local issues? Like for instance, Leadership Council for Justice and Accountability, they work in the Eastern Coachella Valley near the Salton Sea, where they have like crazy dust storms and power outages and water quality issues. And they actually created like a really beautiful park in North Shore, California, where they had a lot of community-led design processes to create that park, in addition to like working the planning firm. And the day the park opened, a storm like ran through the park and like destroyed everything. So like you had to like also think about like, how do you make sure that structures can withstand some of the real issues that are climate impacts in those areas? And how do you make sure you can have like maintenance funding over time so that when these things come up, you can really pay attention to like, yeah, these are not just like trees that are going to last forever. If we don't take care of them, we have to make sure that we know what kind of plants we're putting in this area, that they're like native plants, that they're like drought resistant plants, that we're thinking about things like how does stormwater runoff like run into these neighborhoods? Is there flooding? Are there other kinds of issues, so that you can, do your best to create more resilient parks, and that it's a partnership with everyone involved together.
Emily, I wanted to also ask you that, since you're very into climate resiliency in your work too.
Yeah, I was thinking about what Tiffany said with native plants. I'm also a gardener in my free time, and there's such a huge native plant community, but that's one of the benefits as well, as we're designing them, how are we thinking about how they can be resilient. So there's still a space in the community when you have a disaster event. There's a lot of times where people are meeting to pass out supplies. In Western North Carolina this year, there were truly terrible floods, and finding those safe community spaces for the immediate recovery in both the community building and community gathering in the coming months, and it will probably be years before in that recovery effort are really important. I was going to say something else about this, but I lost my train of thought.
No problem. So on a similar tangent, Emily, you were saying that, people in North Carolina and in Florida who experienced the horrific hurricanes that just happened this past fall, marginalized groups such as the elderly, people who are living alone, pregnant people, people with disabilities, they are most affected when it comes to extreme weather events. They struggle with finding places to escape, getting the help that they need. So when it comes to designing green spaces and building for climate resiliency, how and what are some effective methods that we can use to address these different needs for these different groups?
Yeah, that's a great question. And I think something that kind of, realign things and really change things in my brain when you're thinking about this is, I believe they might not be the first people to say it, but the AARP literature usually says almost everyone will be disabled at some point in your lifetime, whether that is a temporary, you break your leg, you're on crutches, or in a wheelchair as you're recovering from an injury, or if you have the privilege of growing older, you will have something that impacts your quality of life in your later years. So I think if you start thinking about this, how do you design green spaces and improve access for these groups? You're really also designing for everyone at some point in their lives, because I think the example that a lot of people use is what is good for someone in a wheelchair is also good for someone pushing a stroller. So while there are some specific things that you can do for these specific groups, there is a lot of overlap. And I'm not an expert on the design side, but I know that planners think a lot about lighting. They think a lot about how are you getting to the park itself before you even get into a park or a green space. What is the bus line? What does the sidewalk look like? What is that access? So there's so much you could talk about with actual design of the green space itself. But I think what is always top of mind for me is the equitable engagement aspect of this. Tiffany talked about this and made some really great point about how are you equitably engaging these different groups and hearing about their priorities and hearing about their needs, because it could be very different, in communities we worked in, we thought that they would say one thing, and then in engagement, we hear more about, Tiffany, I think this is what you said, that instead of having more parks, they wanted the parks that they already had to be better maintained, which is something that we've heard in communities as well. So you can't even start that redesign or design process until you know the priorities of the community. Maybe it's not a traditional park. Maybe it is just truly open space to host events and have sports activities. There's so much that can be different for different communities. So when people are seeking these safe kind of third spaces, it really, really has to be underpinned by that equitable public engagement. And that's why I talk so much about comprehensive plans, because that might be the only time that they have the local government has the staff and capacity and resources to be doing that engagement. So those are the times to be asking those really key questions about parks and recreation and green space.
Is there anything anyone else would like to add? Okay, we'll move on to the next question. And thank you, Emily, for your thoughts. So I think many of you have already covered this in your presentations, but if there's something else you wanted to add, I would love to hear, and I'm sure participants would love to hear, if you have an example of a program, policy, or initiative that you may have led or contributed to that expanded green space access in underserved communities. And Rachel, I know that you haven't mentioned this before in your presentation, but maybe you want to talk about the P3 initiative?
Sure. So prior to joining the consulting firm MIG, I spent 10 years working with Prevention Institute, which is a national nonprofit organization focused on health equity and the social determinants of health. And we had the honor of working with Robert Wood Johnson Foundation, the nation's largest health philanthropy, to design and then lead a national funding initiative focused on the intersection of racial justice, health equity, and parks. And what was really cool about that initiative is it did not start with folks who were already working on parks in most of the cases. I think the issue of it's really interesting. Recreation spaces and parks were like battleground for civil rights, right? They are some of the most political and politicized spaces we have. They have been the site of demonstrations and community gatherings, to say nothing of all of the personal celebrations we have in our lives. But there is a very strong political history in this work. And yet, right now, if you sort of look around at Parks and Rec, it's not a highly political environment. It's a kind of like, youth basketball, walking groups, Zumba, food distribution environment. And I think that there has been a real separation of the kind of environmental justice, social movement building that Tiffany is talking about, and the more traditional parks and recreation field. I think that public health people or planners who have an eye for public health can be a really critical bridge here, because so many of the communities where we were working on the People, Parks, and Power initiative, and the work is still ongoing, folks aren't saying that parks are their number one issue. They're saying, I can't get my kids safely to school. I can't get to the doctor. I have to work 2 or 3 jobs. I am getting pushed out. I can't get to my church anymore. Wildfires are happening. It doesn't feel safe to live here. All these other issues. And so parks, while very important and personal to people, fall kind of low on the priority list. And I think that is reflected in decision maker perspectives also, where a lot of times people think of parks as sort of nice to have, but not essential infrastructure. And I would say health infrastructure in our communities. So many of the communities where People, Parks, and Power is happening are places where other issues are the entry point. And because all of us here have this intersectional lens, we understand all these issues are connected. I think that it's a great opportunity to be able to say, like, cool, you came in through an EJ perspective, or you came in through a youth development perspective, or you really care about chronic disease prevention or mental health and well-being, whatever it is. the issue of access to nature and, natural spaces and community gathering spaces does intersect with that and with so many other issues. So I could give you 14 different stories about the 14 different places where the People, Parks, and Power work is happening, but I actually think the bigger takeaway is they're entering that space from all different doors. And it doesn't mean that parks and green space have to be the number one issue. It's just about recognizing that this is an issue that brings people to the table. Similar to how I think a lot of us in our work have seen that health is an issue that brings people to the table. And I think the reason for that is this stuff is personal. It's deep. It's like if you think about, where did you have your childhood birthday parties? Where did you have, your grandmother's whatever celebration of life? Where do you go with your friends, right? Like parks are this critical heart space for us. And so I think people are willing to engage around this issue in a way that they aren't on every single issue. And I think that we can use that to our benefit. I'll drop a link also, and as part of the follow-up, I'd love to share the stories of the communities that are doing the work through People, Parks, and Power. But I think, yeah, that's the most important takeaway is like, you don't have to be a parks person, right? And in some ways it's beneficial if you're not. But if you care about any of these issues, this can be a kind of a galvanizing intersection.
I love that. And thank you, Rachel, for closing us off with that last piece of advice for everyone. You don't have to be a parks expert in order to get involved and to advocate for green spaces. I see in the interest of time that we don't have time for a live Q&A, but I know that all of our panelists have been answering questions in the chat. In our follow-up email, we'll be sharing the responses to your questions in the follow-up resources. I want to take some time to share some announcements, but first, can all of us give a virtual applause to our speakers today? I think we all learned something incredible from all of them. They've imparted such wisdom. And, I was so pleased and excited for all three of these speakers to come join us today. And I think I've learned so much. I hope you all did too. Each of them have some key takeaways that we will be sharing in our slide deck that will be shared shortly after this webinar concludes. And as for some updates and announcements, we will be sharing a survey with you right now that is going to take you less than 1 minute. Miguel will pop it up on your screens. It will be anonymous, and I promise you we are looking at them and taking them into account. Our last webinar that we held in August, participants have asked for a webinar focused on the topic of transportation, and we are listening. Next month, we are focused on transportation as our next topic that we'll be discussing. So we will also be sharing a link on that for you to register and save the date. We also invite you to stay updated with us for our latest announcements. In our follow-up email, we'll be asking you if you would like to opt in for upcoming emails for any updates that we will have. So once again, thank you all for joining us. I know all of us have busy schedules. We don't like extra meetings on our calendar. So appreciate you for taking the time out of your days. Thank you.
Thank you, Belinda, for organizing.